Good afternoon, everyone. Thank you for joining us today. My name is Nora Landishak, and I'm the Manager of External Relations here at the Fund for Public Health in New York City. I'm really excited to welcome all of you today to our public health talk on the coronavirus. This is our most attended talk yet, and I know this is an urgent issue for many of our listeners today. A few technical notes before we get started. Due to the rapidly changing nature of the coronavirus and the health department's response, we're only going to be able to respond to a few questions during this talk. You can write any questions you may have directly to us using the chat feature, and we'll also send a survey after this to receive additional questions as well as feedback, and we'll do our best to get answers to you within a reasonable time. The talk is going to be recorded. A copy will be sent to you afterwards. If you experience any technical difficulties at any time during the call, please let us know either by using the chat feature or by emailing info@fphnyc.org. Now I'm going to pass it over to Sarah Gardner, our Executive Director.
Welcome, everyone, and thanks for joining us today. My name is Sarah Gardner, and I've had the privilege of being the Executive Director of the Fund for the last 12 years. For those of you who aren't so familiar with us, we're the independent nonprofit that works in close partnership with the New York City Health Department to improve the health and wellness of the 6.5 million people who call New York City home. Specifically, we do this by identifying and mobilizing resources to support innovation, expand evidence-based programs, and expedite implementation. Most recently, in support of the department's COVID-19 emergency response, we're working on their behalf to raise emergency funding and importantly, support continuity of core programs and to share and amplify important and accurate information about COVID-19. One of the very reasons why we designed these public health talks was so you can learn more about the health department's efforts to combat the epidemic. We're hearing a lot in the news about frontline personnel, first responders, and healthcare workers who are out there on a daily basis, putting their own lives on the line to help combat the epidemic. But we don't hear so much about the public health workforce and the thousands of people at the New York City Health Department and what they are doing in direct response to support this, to direct and support the city's response to the epidemic. Today, we're lucky to have two people representing the health department. Our speaker is Prachee Patel. Some of you may have remembered her from our last public health talk. Prachee works in the Office of Emergency Preparedness and Response, and she is joined by her colleague, Ali Noodleman, who works in the Bureau of Intergovernmental Affairs. And both Prachee and Ali, alongside hundreds of other health department staff, have been activated to work on the COVID-19 emergency. And today we're going to hear from them a little bit about the health department activities in response to the epidemic and ways in which we all can help. Prachee?
Hi, everyone. Good afternoon. Thank you to Sarah for having us today. And, really thank you to all the participants for wanting to learn more about the health department and what we're doing to respond to this pandemic. It's been about 2.5 months since our last public health talk, and I believe there are a lot more participants today than that last time. So I want to start by giving a quick background about the health department. We have over 6,000 employees in 11 divisions covering a broad range of public health activities. There's things related to disease control, environmental health, family and child health, health equity and community wellness, mental hygiene. Those are some examples there. For New York City emergencies, the health department, for the whole city is responsible for certain things that are very clearly in the public health realm, including disease surveillance and epidemiology, public health orders, clinical guidance and risk communications, things related to mass prophylaxis and vaccination, lab testing, public health assessment, environmental mitigation, as well as animal-related surveillance and vector control, and all things related to mental health needs assessment and service coordination. The health department, looks at the world and uses an all-hazards approach. We want to plan for everything, whether it's chemical, biological, radiological, a natural disaster. And we take the philosophy that all emergencies are local and we have a role to play, and that all emergencies will have a public health impact. Within the health department, we have a dedicated Office of Emergency Preparedness and Response, which I'm part of. And our focus is really to plan, train, exercise, evaluate, do risk analyses. We have logistics and operations expertise, as well as healthcare system preparedness support, and we work on community resilience as well. So you can see there's a broad range of things that are related to emergency preparedness. A little bit about how we respond to emergencies at the health department. We use something called the Incident Command System, or ICS, which is a standardized organizational structure, and it's used nationally by first response agencies, primarily in situations where the existing organizational structure becomes overwhelmed. So during an emergency, we can switch from the day-to-day organizational structure to this ICS structure, and it provides a delineation of roles by your title and experience and not your day-to-day responsibilities. That means you could be doing things different than what you do day-to-day, and you could be reporting to somebody different than you do day-to-day. It also provides management tools and structure to efficiently organize staff into those roles. It facilitates clear communication by eliminating things like slang and jargon that we may use day to day. And really, it enables us to leverage the agency's resources, especially staffing, more effectively, because we're able to pull resources across the agency and not, sort of married to the day-to-day organizational structure of what our division or bureau may have access to. Another key point about ICS is it's scalable, so it could be as big or small as needed to respond to an emergency. So if there was like a hepatitis A outbreak in a food establishment, it could be maybe 20, 30 people working on it, maybe even less, or we can have something like the current response where we have upwards of 1,000 staff currently working on the emergency. And all employees of the health department have a pre-assigned response role. So they know beforehand what they may be doing during a response, and they can be called upon to assist during an emergency. So for example, my day job is Director of Grants Management, but I could be pulled into the response and have been for the past several months to do other kinds of activities that are not related to grants management. Taking a step back to, where are we currently in this response? It started, we heard about what was happening in China in late December 2019, early January 2020. And this really started at our bureau at the Communicable Disease in early and mid-January, and there was involvement from other key parts of the health department. By the third week of January, we had escalated to a disease control division-led response. And by the end of January, we had activated our ICS system to bring in and incorporate staff from across the health department. Our early focus was really on containment, things and contact tracing. So you're all probably familiar with the presidential executive order in late January about quarantining high-risk individuals. So those were travelers from the Hubei province or close contacts of confirmed cases, as well as home self-monitoring of others. We, had to move from the containment at the individual level, so the things about quarantine or isolation, to mitigation at the population level. So a lot of the things that we have currently related to social distancing, school closures, business closures, and the stay-at-home, guidance that we're in right now. It's important to note for a response of this scope and size that city, state, and federal coordination is key. This includes close collaboration with federal HHS and CDC, the New York State Department of Health, the city's emergency management agency, the fire department, the police department, as well as many other city agencies, as well as the mayor's office. And critical also is with our healthcare and community partners. So this is a public health emergency, but the health department is not alone. We are working with a lot of other partners to make sure we have an efficient and effective response. We're also taking the time to learn from other countries, what's happening in Asia, what's happening in Europe, and we also want to be sure we're sharing lessons learned that we are experiencing here in New York City to other states and cities in the U.S. The outbreak is biggest here in New York City. We want to be able to share what we've learned, what we can, provide any information or guidance to our counterparts across the nation so that they can also have efficient and effective responses. So I'll go a little bit into what we're currently focused on right now. We continue to maintain awareness and monitor what's happening with coronavirus activity, both internationally and domestically, and specifically in New York City. And a lot of that has to do with monitoring, data and information on the trajectory of the local epidemic. And we use things like models and other data tools and things to see how our response is going. You've probably seen in different newspapers or academic journals a lot about modeling. There are also limitations there. We also are doing a lot of activities related to surveillance and tracking the course of the pandemic as it evolves. And that includes tracking the impact of the disease on chronic medical conditions, community health, and healthcare access. It's not just about COVID-19, it's about what that impact is on things that are pre-existing in terms of medical conditions and other things. We're also continuing to do testing at our public health laboratory. New York City happens to be a place where there's a lot of testing going on. So that's one of our very important focuses as well. I'm sure you've been seeing in the news the impact on the healthcare delivery system. So we continue to engage with our partners there to support and coordinate our response efforts. That includes making sure that we're giving them operational support and strategizing with our partners about staff and space, supplies, equipment, all that kind of stuff. We also want to make sure that we are providing clear and accurate technical assistance and mitigation strategies and guidance wherever we can. And we're also working with them to set up alternate care locations and ensure that they're operationalized and coordinated. So you've probably read about Javits Center, you've probably heard about USNS Comfort. So those are what are called alternate care locations. You've probably also heard a lot about PPE or personal protective equipment and other medical equipment like ventilators. That's been big in the news as well. So we are doing tracking, prioritization, and fulfilling of requests for the healthcare system. We're using our existing inventory as well as items received from the federal government. We're taking in donations. There's a lot of receipt, storage, packing, and distribution across the entire city for our healthcare system support. Related to healthcare staffing, you may have also heard that there's a need for more nurses and doctors and healthcare professionals of all kinds. And so we're working with our city partners to recruit and assign additional healthcare professionals to support the healthcare system surge staffing via the New York City Medical Reserve Corps, which is a cadre of volunteer healthcare professionals managed by DOHMH. And related to all this healthcare work is that inevitably people are going to be transferred from one facility to another. It could be from one hospital to another. It could be a nursing home to a hospital. It could be a hospital to Javits. And we need to make sure that family are able to track their own family members and be reunified. So we're working with city partners to support family reunification by locating individuals that are in these healthcare facilities. Another thing that we're doing more recently is that there are bound to be people who have COVID-19, but they're not sick enough to require hospitalization, and it wouldn't be a waste of resources to keep them in the hospital, but they can't return home. So maybe they have a person with underlying health conditions at home, or maybe they have small kids. Maybe they're not from New York City. Maybe they live in a dorm, like they're a student. So they can't go back home and they need to stay somewhere to isolate. So we're actually working with other city partners to find hotels and keep these people that need to be isolated in hotels. And we're making sure that those operations are being run, and we're monitoring that as well. Another area where we might see additional cases are in congregate care settings, such as homeless shelters and jails. So we make sure we're providing updated guidance to other city partners who can operationalize those recommendations for congregate care settings. These are places where we can see clusters or small outbreaks occurring, and we want to make sure that these vulnerable populations, that there's a plan in place to either quarantine or isolate or provide appropriate medical care. Related to mental health, clearly this is a pandemic and a situation we've never been in before. We want to make sure that we are promoting emotional health of all New Yorkers and providing resources and guidance to support both our staff and the public for all of our operations and activities. It's going to be a long response and recovery period, and there's a lot of things going on that could exacerbate pre-existing mental health or behavioral health issues, but it's also creating a lot of additional in terms of fear and anxiety, stress, all of that related to the pandemic. We continue to create evidence-based and response-specific information and guidance for New York City providers. It's really important that we're able to, digest and compile all the different guidance coming from the federal government or from the New York State Health Department, and providing up-to-date and accurate information for what seems to be changing almost daily to our healthcare providers to make sure that they are staying safe and they're able to provide the necessary care to anybody that comes into the healthcare facilities. And that includes tracking the impact of COVID-19 on indicators of community mental health and access to care. It's not just health care, it could be mental health and behavioral health care as well. We're also operating for some time now a 24/7 call center. There's actually multiple call center operations going on to provide timely and accurate information regarding COVID-19, including up-to-date guidance from the health department to the public, the healthcare providers, congregate care settings, all these different audience types to make sure they have the information. We are doing a lot of media and education. We want to be disseminating messaging to the health impacts via all different forms of media. So you may have started to see ads on the television or subway ads, bus station, newspaper. We want to make sure that everyone has understanding of the health impacts of the pandemic, but we also want to mitigate risk, stigma, and fear. We also are working very closely with our city, state, and federal partners. As I mentioned earlier, we want to make sure that we're maintaining and strengthening bi-directional communication. Again, we as a city are not in this alone. We need both the support from others, but also information, and they need us to execute a lot of these operations. We're also working very closely with community partners. We want to make sure that they are engaged to inform an equitable response. We want to help, work with them to help combat stigma, fear, and information. Community partners are on the ground. They're in the neighborhoods. They work with people every single day. They know more than what we do or what the government does about what people are thinking and feeling, what they need, how they can help. So it's really important that we have ongoing and meaningful engagement at the community level for any response, particularly for this one. A few last things is we are continuing to make sure that our city workers are also protected. So, not just the health department, but there's a lot of other agencies that have field work. They may be doing home visits, sanitation, the police, the firefighters, all that. We want to make sure that they have the guidance, the tools, and trainings to protect the city workers. And finally, related to response, but sort of the flip side is that while all this is going on and we've sort of diverted, 1,000+ people towards response activities, we also need to make sure that the health department is continuing to provide some essential services that can't really stop even during an emergency. So that's things like birth and death certificate registration, our poison control center, things related to biothreat testing at our lab. And we also need to consider any public-facing services such as our tuberculosis and sexual health clinics. Just a quick update on some new things on our health department website. There's a new guidance on face coverings. There's an engagement portal. So New Yorkers who have symptoms or tested positive for COVID or have come in contact with someone who may have COVID or are currently in quarantine, you can go to this portal and provide an update on your status. There's updated information about social distancing rules in the state. There's updated data. This is the most sort of new hot off the press in the last couple of days. Is there a new data page and it's interactive. You'll be able to see the case count, hospitalizations, deaths. You can see daily counts. You can see race by borough, age, and sex. And most recently, we just added race. There's updated information for healthcare providers, and there's also information about how to file a complaint if you feel you've been harassed due to your race, nation, or origin of your other identities. I think I'll stop there. I think that was a lot. So, I'll hand it back to you, Nora.
Thank you, Prachee, so much for giving us all of that information. It was very helpful, and we really appreciate all the work you and your team are doing to keep the city safe. We have a few questions for you. You mentioned briefly that this epidemic is impacting some of the other services that the health department is offering. I was wondering if you could speak a little bit more to that and discuss some of the challenges in continuing to deliver those services.
Sure. Yeah. I mean, any emergency that will have an impact on the agency, small or large, depending on what it is. We have what's called a continuity of operations, a COOP plan. And in that, it outlines the services which are uninterruptible. So those, again, are the ones that we must continue regardless of an emergency. They could be modified. For example, we could process things online instead of in person, that kind of thing, but they must continue. We also consider, as I mentioned earlier, the public facing, those are not essential and those are not uninterruptible, so we can reduce or suspend them. Some examples include, our TB and sexual transmitted infection clinics are closed. There's only one location of each of those clinics that's currently open. We can reduce the inspections of food establishments or daycare facilities. We can close our immunization clinics, and we can suspend dog licensing operations. All of these things have happened for this response. Anything that can be done remotely continues via virtual methods. A lot of the staff at the health department currently are working from home, as a lot of other businesses have moved to. For any instances where we can continue doing things via virtual methods, those services are continuing, including telehealth for some of those clinic services I mentioned earlier. I'll mention that you can actually find this stuff on our website. If you go to nyc.gov and you search agency suspensions and reductions, you can get the latest updates from the health department as well as other city agencies. So, for example, if ACS has any changes to their services, or if any other agencies have changes, you can find them on the nyc.gov website.
Great, thank you. So we have time for one more question. I'd love to know, and we'd love to hear a little bit more about where does the health department need the most support right now as it manages its COVID-19 response?
Things are just so changing rapidly. I think, we still have a long way to go. I said both in the response and the recovery phase. I think community level initiatives will be key for the remainder of the response, and also what we anticipate will be a long recovery period. So work directly with community partners to provide ongoing guidance and risk communications to the communities as we sort of move through the different phases of the pandemic will be really important. They directly serve the population. If there's ways for them to keep individuals, how to stay connected and how to access medical, mental, and behavioral health services, that's going to be really important moving forward. We still see a need for donated time. We talked about volunteer opportunity for healthcare professionals, but there are other opportunities. We still need supplies and equipment. People can, if you donate space, we've been, hearing from people throughout the city, I have 3 hotels. Can you use them for anything? Like, yes, absolutely. So information about how you can help can also be found on our health department's COVID-19 website, and it includes various links about volunteering and donating opportunities, helping source or make products needed for the healthcare system, selling or donating to the city, including medical spaces, offering space for emergency operations or community outreach, as well as donating PPE, that's personal protective equipment.
Awesome. Thank you so much, Prachee, again, for your time today. That's all the time we have for our webinar. We're going to be doing these calls as often as we can during this epidemic, and we're really grateful for the health department's time during this crisis. For our listeners, just a reminder that you'll receive an email later on today with a link to the recording and a survey where you can share any additional questions you may have, as well as feedback for topics you might want to hear about next time. And just a final note, the Fund for Public Health, as the partner to the New York City Health Department, does have an epidemics fund. All the donations that are currently coming in through that epidemics fund are going to the areas of greatest need related to the COVID-19 response as determined by the health department. And if you would like to give to support our epidemics fund and the COVID-19 relief efforts, you can visit our website. The link is visible on the screen. And finally, just please follow us on social media, Twitter, Facebook, and LinkedIn to stay updated and learn about upcoming talks, as well as any other information that we can share with you. Thanks so much for joining, and we'll follow up shortly with that email. Thanks, everyone.